Hello, good evening, everyone. We meet again, and today I thought that I will brief you all regarding the ovulatory disorders which cause female infertility. So now the first question is that what is an ovulatory disorder? So any condition which does not let an egg form at a normal time and at a normal pace is called an ovulatory disorder. So we all know that in order to achieve pregnancy, a healthy egg needs to be produced every month so that it can be fertilized by a healthy sperm to produce pregnancy. So there are many conditions which alter this ovulation process in a female, and these are called ovulatory disorders. Now, if we want to categorize, now how important is ovulatory disorder? Of course, we know that there are three broad categories which cause infertility in female. So they could be tubal, they could be ovulatory, it could be uterine, and then in the end, there is about 30% of cases who also have an unexplained infertility where all the parameters are normal, even the male parameter is normal, and still, they are unable to conceive. So we can see that ovulatory disorders, they form a very major chunk of problems. Now these ovulatory disorders can be by birth, which could be central or it could be ovarian, or these ovulatory disorders can be something which a woman can have later on in life. Now, how will a girl know that indirectly? So it's not that every time she would come to know, or if you reach a gynecologist, how will they know that yes, possibly there is an ovulatory disorder? So either the problem can be from the beginning, that is the time when a girl attains her first menstrual cycle, which is around the age of about 10 years nowadays, 10 to 11. Now, if a girl does not get her menstrual cycle by the age of 14, where there are certain special characters which we look at, if they are, developed, or up to the age of 16, where certain characters which were present or we want to see in them, which is called the secondary sexual characters, depending on them whether they are present or not. But by the age of 14 or at the maximum by 16, all the girls should achieve their menarche. Now, if they are not attaining their first menstrual cycle, then that is the first point in the life of a girl where, yes, we could be expecting that she is going through an ovulatory disorder, possibly. Of course, there are other causes of not getting the periods, but here we are talking about a condition where the girl has a normal uterus, has her ovaries, but possibly these ovaries are not functioning, and which is not leading this girl to have her first menstrual cycle. So menstrual cycle is a very, very important indicator of an ovulatory performance. So number one is not getting her menstrual cycle at all in life. And then, she visits a gynecologist. There are certain investigations which are done, and we find out a problem. And then we find out that this girl will only get her periods with the help of certain medications. Or we could just find out that, yes, this problem is transient, and possibly in future, this problem can be corrected. The second feature, what later in the life, what women can come up with, is not just not having periods at all, but it could be also having very short menstrual cycle. So if suppose a lady who comes at the age of around 37, 38 to me and says I've started having very short menstrual cycles, then that is also an indirect indicator that yes, there could be a menstrual or ovulatory problem in this particular lady, because now her cycles, which used to be about 28 to 30 days, are not coming at that interval, but they are coming frequently, say about 20 days. There is one, reason, that is the ovulation problem, which could be happening. The second is very, very delayed cycle. So the normal menstrual cycle is somewhere between 25 to 33, 34 days. But typically now the cycles are getting delayed. So they are coming at an interval of about 40 days, even more than that. Sometimes girls do not get their periods, even without a medication. So delayed cycle is also a sign of ovulatory disorder. Certain other signs which are indirect indicators of ovulatory disorders could be having premenstrual spotting. So the menses come on time, but however, about a week before or few days before the menstrual cycle, the girl starts to get her spotting. If a woman is getting the spotting, then also it could be an indirect indicator that there could be a problem in the ovulation. Also, post-menstrual spotting, if you're continuing with it, or irregular spotting, these are all indirect indicators that yes, there could be an ovulatory problem. Now, how much importance we need to give? Yes, it's very important because it's a very important aspect when it comes to fertility. The right kind of mature egg forming at the right time is most important to achieve pregnancy, provided the tubes are open in the female partner and the semen parameters are normal when it comes to the male partner evaluation. So, how will we start investigating? So, yes, there are two scenarios or three scenarios. Number one, when a woman presents with these menstrual abnormalities, then irrespective of her age, I would like to check her ovarian function. And I would also be doing an ultrasound to check whether the ovaries are normal size and the baseline follicles, which tell us that what is the robustness of the ovary, or which tells us that how well can an ovary perform. We would be evaluating that. All the women who are going through IVF or an IUI procedures, I would be getting an ovarian reserve checked. All the women who are above 35 years of age, yes, it is very important to check their ovarian reserve and if they have any ovulatory disorder. And of course, which I said that any menstrual deficiency, we need to check for ovarian disorder. If there was a family history, which is a direct genetic family history, which is available, then it also becomes very important to note down. And that is why it is important to find out that if suppose a girl never started to have her menstrual cycle, then is there a similar kind of problem if she has her sisters or her cousin sisters? Did mother have some kind of an issue, when she started her menstrual cycle? So it's very important to know the family history. The second thing is that once we know that yes, we want to, check her ovulatory status, what are the few things? So the first is the menstrual history. We would also like to check certain hormones. Now, very, very important hormones which come in our evaluation are called as like follicle stimulating hormone, FSH, which is typically done on the second or third day or up to the fifth day of the menstrual cycle. This is called baseline hormone evaluation. Now, it is very important that when we start evaluating a girl, a woman, we need to ask her that was she on any hormonal treatment. If she was on hormonal treatment, it is important that we discontinue this hormonal treatment for a few days and then get the baseline hormones checked, because there can be a false low report which we could be getting and which will hamper in interpreting these reports. So the important hormone which we would like to do is called FSH. We would like to do additive hormones like LH and estradiol, but most important would be FSH out of the three. Then we would be doing a hormone which is nowadays very popular called anti-Mullerian hormone or AMH, thyroid, prolactin, and a good ultrasound. So if we have these informations available, then most of the times we will be able to reach a diagnosis for the reason of ovulatory disorder. Now, why it is important to know that if we say that, okay, her menstrual cycle is so significant and is available to us, then do we even need to know that does she have an ovulatory problem? Because we already know that she has one. Well, it is very important to diagnose now that there are three very distinct type of ovulatory problem. Now, in the first one, the brain is not giving appropriate signal, maybe by birth or maybe later on. Certain times, girls can also have a brain occupying tumors, which could be causing very low signaling from the birth. So, if the signal is not coming from the brain to the ovary will not be producing its follicles because there is no hormone which is available. And this kind of a condition, which is called hypogonadotropic hypogonadism, will be treated in a very different way than the other two types of ovulatory disorders. So, the first one And how will we know that whether she has this or she doesn't have it is only by hormonal evaluation, because her FSH level will be very low, to the tune of less than 1. And then we will diagnose that yes, she could be having this problem. Now, this problem cannot be cured. However, the fertility can be achieved with the help of injectables, and the girls need to be kept for a very, very long time on hormonal preparation so as to produce follicular growth. The second group is like typically, very commonly patients come and tell me that I have polycystic ovaries. Well, polycystic ovary is a hormonal disbalance where the ovaries are enlarged, have a lot of baseline follicles. There is no problem in the central signaling, and these are the girls who can actually be treated with weight loss, with lifestyle management. This tremendously helps these kind of women. And along with it, they just need simple medications initially to form an egg. By lifestyle medication and modification, as well as weight loss, a lot of girls will be able to get pregnant on their own, because the ovulation would be resuming with the correction of the ovulatory disorder. Now, if that is not happening, then this group of patient, of course, can be started with oral medications, which we give for about 5 days, and which can help them in forming a beautiful egg growth. And I would say about 40 to 50% of patients will conceive with the help of medications. And then later on, of course, there are injectables which could be given, which we know that if oral medicines are not working, they will work. So the first two type of ovulatory disorders can be tackled with the help of medications, whether in one group with oral medications, in the other group only with injectables. However, the third group is unfortunately the group where the ovaries are into failure. Now, these ovaries can be into failure right from birth because of some genetic issues, or these ovaries could have gone into failure prematurely as compared to the normal age at which we are expecting menopause in our Indian population, or have gone through certain surgeries on ovaries, even in conditions like endometriosis. Patients who have gone through cancer therapy, they all have premature ovarian failures. And this is the most unfortunate group, because in this group, once the ovarian failure is established, or if there is an established ovarian failure by birth, these women unfortunately will not be producing eggs. However, they also have an opportunity to have pregnancy, but would be having pregnancy with the help of donor eggs. So it would be the husband's sperms, but using donor eggs, and the uterus can be made functional with the help of cyclical, a patterned hormonal replacement. But it is very important to diagnose them. Now, there are also conditions where the women has not gone through ovarian failure, but we know like she would be going through a cancer therapy. Now, it is very important to offer them egg freezing, and which is very commonly practiced nowadays. Yes, I have seen an increasing trend and awareness in these girls where they are about to go through a cancer therapy, and with the help of the oncology team, we make a plan for them, and we have been doing egg freezing since many years. So this is a opportunity for those girls who know that they have a genetic disorder in the family and will land up in premature ovarian failure, or for any reason they know that they would be landing up in ovarian failure, or girls who are going ahead in their age, have not found a partner, are the women who could be offered neck freezing. So, judging an ovulatory disorder is very important. Coming to a diagnosis of this ovulatory disorder is very important, because that is the only way where the right treatment can be instituted to them. So, I hope that I've been able to give you certain tips, important tips about importance of ovulatory disorders, how to diagnose it, and how to tackle it. Humaira wants to ask that IVF injection के टाइम क्या डाइट ली जाए कि एग की क्वालिटी अच्छी हो. सो हुमायरा, एट द टाइम ऑफ आईवीएफ देयर इज नथिंग मच विच कैन बी डन. डाइट एक ऐसी चीज है जो आप सालों साल से ले रहे हैं. हेल्थ आपको कई सालों में अपना बेनिफिट दिखाता है, तो ऑन अ रूटीन एक हाई प्रोटीन डाइट लेना जरूरी है. थोड़ा सा लो कार्बोहाइड्रेट लीजिए, सो दैट स्पेशली फॉर ओवरवेट गर्ल्स, इफ दे आर ओवरवेट, तो अगर आप एक गुड क्वालिटी प्रोटीन डाइट लेते हैं, उसके लिए आपको कोई बाहर से प्रोडक्ट्स खरीदने की जरूरत नहीं है. आपके नेचुरल जो रोज के खाने में प्रोटीन्स होते हैं, उनको बढ़ा दीजिए. Humaira again asked that I'm facing PCO and what is the solution? Yes, Humaira. So, PCO is a type of ovary you were born with, and that ovary will not change. But gaining weight can increase your problems of polycystic ovaries. So, keep exercising, keep having a low carbohydrate diet, keep your weight under control. With this measure, certain girls will get their ovulatory patterns into a normal pattern, but certain women will need treatment. And yes, you can visit us, we can guide you how to bring egg growth. Sakshi is asking, I'm diabetic and also facing PCO. Yes, it's a very common thing, Sakshi, that in families with diabetes, this gene is common for PCO and diabetes. So, diabetes in the family and PCO in their children is a common finding. And if it is added with weight issues, which I have been emphasizing, then it can increase the problem. So, again, Sakshi, you have to be very careful about your diet. Have a diet consultant, have regular exercise, which includes about 5 days in a week, minimum 30 minutes of brisk walking. And if you can introduce 2 days of weight bearing, is some exercise, is something what you would need, and a diet which is a bit low in calorie, and maybe lifelong people with PCO need to follow this. It's not only PCO, every person needs to be medically fit, but for PCOS girls it needs to be more important. Jyotika is asking that how many women are facing. Well, we are a very huge population, Jyotika, and ovulatory disorder is 1/3 of the whole problem of female infertility. So you can imagine that every third girl would be presenting with infertility, would be landing up, with some kind of an ovulatory disorder. But out of all the ovulatory disorders, PCOS is the most common. What are the risk? Well, the risk in especially PCO girls, because they are also related to obesity, more estrogens. In long term, there is no direct risk other than infertility. But later on in life, if you are not menstruating regularly, in PCOS girls especially, will be increasing the risk of cancer, which is endometrial cancer. Number two, in girls who are estrogen deficient and have gone through premature ovarian failure, they need to look into their bone health, because they will have accelerated bone loss and osteoporosis and more risk of heart problems later on. So it is important for them also to be on hormonal treatment till the age of natural menopause, so as to prevent them from bone loss and heart risk. Priya is asking, what are the signs that I am not ovulating? Well, it is the menstrual history, which I said it's very important. Short cycles, delayed cycles, spotting before cycles, not getting periods without medicine, then breast discharge with delayed cycles, hypothyroidism with delayed cycles are the signs of ovulatory disorder. Richa, what kind of ovulation disorders can interfere with my infertility? I just explained to you that there were three types of ovulation disorders. One is central, one is polycystic ovaries, and the third is ovarian failure. So these are the three major categories in which we can, divide. And other than that, are thyroid disorders and prolactin disorders, which can cause ovulatory dysfunctions. Thank you very much for joining me, and see you next week.